Hi, and welcome to all who are able to participate live or by listening to the recording of this session on supporting local partners during COVID-19, and I would add most importantly, beyond that. My name is Alberto Andretta, and I'm serving as the director of CRS's Partnership and Capacity Strengthening Unit in our overseas operations. It's one of the largest departments that our organization has. I'm joined here today by an extremely engaging, experienced, and very interesting group of colleagues, as you will see. Allow me to quickly introduce their names. We will be hearing from each one of them during our time together. Father Amal Raj is the first one, is the director of the Regional Bishops' Conference for the Social Work Forum in the Bihar region in India. Ms. Souraya Frem Baroud, president and co-founder of CDLL in Lebanon. Ms. Maya Rao, a meal monitor evaluation accountability and learning manager in a USAID funded project with Catholic Relief Services in Mali. Ms. Jenny Burns, a senior program officer at Christian Aid in the UK. And Mr. Jesus Melendez Vicente, a senior technical advisor with IRIX in the US. With most colleagues from international organizations unable to travel, unable to be physically present and meet partner organizations and local communities, the COVID-19 pandemic has in a way forced the international development and humanitarian sector to adapt to an adjusted way of working. This phenomenon, this reality, has necessitated, has accelerated an approach that the development and humanitarian fields have always praised as a desirable outcome and referred to in various ways, such as local ownership, local leadership, self-reliance, etc. This has led to a renewed focus in the last few months on the role of local actors by increasing the space of their agency and leadership. As we will find out, ICT for these solutions can in fact contribute as an enabling factor. The underpinning question that we will be exploring with our panelists during this session is the following. Will this local focus, supported by ICT for the solutions, ultimately lead to a fundamental change in the system and offer the opportunity to shift towards more of a leadership role for local organizations? The menu that we prepared for you today is made up of three parts. First of all, we will listen to the experience of leadership from two partner organizations in India and Lebanon. Secondly, we will be hearing from three colleagues from international NGOs and how they had to change the type of support and approach to facilitate local leadership by leveraging ICT for these solutions in the work that it did with local organizations. And thirdly, we will be open up the space for a conversation, right? We'll be hearing any reaction, comments, or any additional question to, from panelists and to the panelists. As a reminder, and if possible, just to make the meeting a bit more lively, let's try to turn on the cameras as we speak, both presenters, panelists, and any member of the audience that would ask any questions. So with no further ado, let's now begin with some of our partners in sight. I would ask Father Amal Raj to start. Over to you, Father Amal.
Thank you, Alberto. I am Father Amal speaking from India. I will be speaking on my experience of COVID-19 pandemic, how we have implemented our programs and how we have utilized the ICT methods for a better implementation. I will be covering in 3 points. The first point is the education helped to stay connected during the lockdown and afterward to continue our work which would have stalled otherwise. The second point I would be talking on flexibility and trust displayed by the global support fraternity. And the third I would be talking on ICT-based infrastructure for a better development and resource generation is a key to future growth. On these 3 points, I will be talking some of my experience during this pandemic, which is how we have implemented. On the first point, I would say the digitization helped to stay connected during the lockdown and afterwards to continue our work in a better way. In fact, digitization helped me to connect with our field staffs to gather information about the distressed communities whom we serve. Luckily, before the lockdown, we had given some of the Android mobiles to our staffs, which helped us to gather a lot of informations of the distressed communities in a big way. So we got a very better information and connected with them so that we could implement our programs. Again, it also helped me to connect with the donor agencies and for a better guidance and inputs and their assistance. It really helped me a lot. Then it also helped me to seek a from government officials permissions. In the pandemic time, it was a strict lockdown. We could not travel. So we need to seek a special permission from the government agencies. And the officials through the ICT, we contacted them and they gave us a permission to implement the programs, COVID response activities. Then it also helped me to contact the suppliers to procure our relief materials because the COVID-19 affected and infected many people and our communities were really starving. So we did a relief work among them. With the help of that, we could through the help of ICT, we could procure the materials for a relief supply, and we did it very nicely. Then it also helped me to mobilize local volunteers. Wherever we are implementing the programs, it really helped me to mobilize local volunteers who proved very helpful and useful and handy in selecting the beneficiaries and managing the distribution and so on. So again, the ICT method for development also helped me to connect with the many resource persons in our team. We wanted to have a capacity building programs, many programs. So we could connect with the resource persons for online capacity strengthening activities for our staff. It includes also a capacity building on COVID awareness program, which we had it through online, which was organized by the CRS and the Caritas India. We had it in the online. Then many of our internal and external meetings were held on online to save our resources like time and money. In fact, we had our review meetings of our agencies and board meetings of our agency. We all had it through online methods. So that helped us to save the time and money also. And it is some of the resolutions were passed by raising the hands. That way we followed the methods of the governing body members meetings, board members meetings. Then again, we have transformed to digital publications. and digital knowledge building efforts we had taken. Earlier, we used to print the things and all. Now we are conveying to our staffs and our local supervisors and animators through the WhatsApp messages. We are sending the publications, everything to them. So they will get the through that WhatsApp. They are transmitting the those things to the people, to the communities. So this is my first point, and the second point I would like to talk is flexibility and trust displayed by the global support fraternity, like our INGOs, donor agencies. In fact, because of the pandemic, we had to change our approach in monitoring of programs and switch to digital monitoring and mentoring support to the program participants. So when we had changed the approach of monitoring and the mentoring support of the programs, this was very much accepted and appreciated by the global partners, like our supporting agencies like Miserior, Kinder Mission, and Monas Unidas. They all were supporting our programs, various programs, livelihood, disaster management, and Women Number One program. Those programs we could have a flexibility in that. And we were trusted, and some of our projects got ended. Because of that, we requested them. They extended the deadline, and even the fund required, they have transferred to us. So there was a flexibility we have experienced from the global partners. Then the support by the global partners have been shifted in allowing rescheduling the regular project activities to COVID-19 related activities. When I say regular project activities, means we had plenty of money for training programs. Those training programs were conducted in online, so the money was left, and those money were utilized for a COVID-19 response, COVID related activities. When we asked permissions, and they really granted us, and we could implement the project, this COVID related activities in our communities. Again, one point I would make here is development of a local fund could help the NGOs to cover overheads, because in India there are so many migrant workers came from different parts of cities to our communities. For them we need to support. So there is a great need to support migrants and their families to find a local employment and link them with the government schemes. For this, we need overhead. This ones. Some of the this partners, NGOs, they did agree, and they said that we will support you in that. So this is what I have experienced during this pandemic. Because of the pandemic situation, the NGOs, especially the funding agencies like Miserior, Kinder Mission, and Monas Unidas, Caritas, they all were very, very flexible towards implementing our programs. Then I would, third point I will discuss is that develop ICT-based infrastructure, and resource generations is the key to future growth, I would say. Because for a development, of course, in India, the rural, we have infrastructures up to a supervisor. Communities, they don't have much. So we need to have a kind of ICT devices infrastructure in a parish level and or a panchayat level, so that people could go there and get information from there. So the ICT infrastructures we need to develop. If we develop those things in the panchayat level or a parish level, it will help us to implement in a better way. So it is ICT based infrastructure is needed to develop for the future implementation of our programs. We need to have better implementation for devices, ICT devices we need to have. Then again, I would say in this point, shifting to more locally led delivery has a great potential to enhance long-term effectiveness of responses and contribute to the sustainability of the programs. When I say this, this capacity strengthening of local partners and transferring the responsibilities to the local partners, and allowing the local partners to take a decision making in their hands, which will help, which will grow mutual trust and mutual transparency among us. So this 3 points I would like to make in my presentation. This will help us to implement. In fact, ICT did help me to implement programs in a better way. Because we are covering almost entire Bihar, 38 districts to cover the programs. It is very vast areas, and so we used this ICT for development this material devices and helped to implement the program in a better way. Thanks a lot for giving me an opportunity to speak on my experience of the COVID-19 implementation program. Thank you very much, sir.
Thank you, Father Amal, for your insights and experience that you share with us. We will be able to ask additional questions or clarification toward the end of our session together. But now let's move directly to Lebanon. Souraya, please, the floor is yours.
Yes, hello. Thank you. I'm happy to be on board. As many might be familiar, Lebanon is witnessing lately multiple crises that led more than 50% of our population to drop below poverty line. And then came COVID-19 and topped by the blast that destroyed the heart of the capital, its major hospitals, infrastructure, and made the huge material and human losses. People were meeting to help each other with limited protection equipment, and it goes without saying that cases today are on the rise. Lebanon having today one of the highest number of active cases in the Arab region. To briefly present CDLL, we work into protection and development, focusing on youth and women. And we have treatment, prevention, and livelihood programs. We run 4 facilities, and part of them are rehabilitation center for substance-addicted individuals and their families. And we welcome patients into our primary care center in Baroud in response to the blast that is also in partnership and funded by the CRS. So as you can see, we take care of individuals with very vulnerable health and mental health conditions during very critical times. So digitization not only changed the way we worked, but allow us to simply work and be next to those patients in extremely difficult times. The lockdown came abruptly, but interestingly, we saw change coming overnight. It was like a reflex. In 2 days, everyone was able to work from home. And the same week, online one-to-one and group sessions with patients were conducted. We had to get regularly, of course, feedback with our patients to make sure the quality of our intervention is satisfying. And we were using platforms to facilitate meetings and the sharing of data. One main reason, I think, is preparedness. So on the logistic level, we had the availability of material. Thank God we had laptops, so everyone can take them home. We had backup procedures and especially IT support to guide us through all of that. And we had systems on the programmatic financial stocks, etc. And the fact that our staff, we have a rather young team, so they were very familiar around technology, and this helped to really go fast on working from home. Now, as we hope that COVID will be over, we have to reflect on 3 things. One, how to take the best aspects of online and combine them with the best aspects of the traditional aspects to provide our services. 2, how to increase productivity through digitization. And 3, to what extent can we really digitize with the gap in resources, infrastructure, and culture of digitization. So this is a bit how internal things are happening. And now we are here today because of the opportunities we had in the past, thanks to global partners, to strengthen our capacity and be prepared for a moment like that. So because they were here and are still walking by our side as mentors, and until now they are still giving advice, allowing us the flexibility to review activities and switch them online, or simply work them in a way to respond to current circumstances. And as a solid example to give is our partnership also with the CRS that dates since 2016. We have been part of the peer group network, and we were prepared to respond collaboratively to disasters, which came, of course, handy with the situation. CRS supported in building our capacity and digitize our system in order to have more autonomy and accountability. This has led us to maintain transparency and efficacy during the time of crisis and become more trustworthy. Thanks to that, we have been receiving more funds and donations and been able to respond to the COVID, the crisis, and the blast altogether. As we move towards more leadership, there's also the responsibility of proof. And in state of emergencies and in low resources area like ours, it's becoming vital to efficiently and comprehensively manage our data and our processes, of course, and make them truly accessible. So first, for example, if we had the possibility to track impacts live as we go, it will really help us make more informed and fast decisions. If we were able to train our staff on project management softwares, for example, it will help us streamline smoothly our operational processes and will help us surely save valuable time during the time of crisis. And of course, having more focused evidence will lead us to also have build a strong advocacy point and help donors contribute towards the community's real needs. But there are gaps, of course, to bridge, and we know that digitization can increase the productivity. But again, the question is, to what extent are we able and ready to digitize with this lack of resources? So we have three challenges, in my opinion: the sustainability, because we need technology and we need the resources to equip, maintain, and especially renew. We need quality, the quality of the infrastructure, the connection, the possibility of having IT support, which is not really, not everyone has it, at least not all NGOs and local NGOs. We need efficiency, so we need our staff to be trained in order to use new softwares, new data collection, and especially to instill this culture of digitization on all levels of our organization. We knew that we needed to go digital, but I think COVID now pushed the conversation. We have the flexibility to work from distance. It gave really safe options to our staff. And I can say also gave time for our managers that choose to be on the run to focus more on the operation. Of course, some work still need to be performed in person, like food aid, provide medical care. But for sure, working remotely with limited supply, at least we will focus our supplies to like protective equipments for field staff who are at greater risk and need, while others can stay home. And as I said, preparedness is a key. Training staff, using modern digital platforms, receive enough resources to maintain updated systems. And again, I just needed to end with this by saying that established bonds and shared values and trust made working from distance possible and easier. But bonding is still a challenge. We need to find maybe more interesting ways and interactive tools to be able to connect with colleagues, with partners, and with patients, to reflect on big things like organizational values, brainstorming ideas, not only on the operation. And of course, we still need to connect live for the sake of the most vulnerable. I'd like to end with a small quote from Rakesh Baranya, who's the humanitarian impact data at Salesforce. Digital transformation has always meant more than just the adoption of technology. Fundamentally, that's been the easiest part. To truly transform, organizations have to unify people, process, culture, and technology, which is no small change. Thank you.
Thank you, Souraya. Very, very interesting. Thank you, Father Amal. You touched upon so many important points, right? You spoke about the importance of culture and trust between peer organizations and with international organizations to allow for that enabling environment. You spoke about data culture, right, and culture of the digitization. You spoke about the importance in that relationship of mentorship, including peer mentorship, right, within networks. You spoke about how the increased leadership also comes with increased responsibilities as well, right? And how ICT solutions has helped not just to continue to the implementation of the programmatic work, so to speak, but also the ongoing formation and capacity sharing as well. So you touched upon so many things. Now, let's move the conversation to include 3 other actors from international NGOs. And I would like to ask Maya to go first and to hear from each one of our colleagues how their role as in specialists within international NGOs has shifted, what they contributed to this increased local leadership of local partner organizations. Maya, please go ahead.
Okay, thank you very much for this opportunity to participate in this panel. As the meal manager for the Rapid Response Mechanism at CRS Mali, which is funded by USAID's Bureau for Humanitarian Assistance, we're providing critical humanitarian assistance to people who are displaced because of conflict in the center and the northern part of the country. And this conflict has been going on since 2012. And the project conducts rapid needs assessment and provides responses in food, shelter, NFIs, and WASH to IDPs and host communities. And we work very closely with local Malian NGO partners based in each region and the government of Mali's Direction of Social Development Services to implement the project on the ground. And our project has been going on since 2016, and we're currently in our 4th phase of implementation. And in terms of what's changed during COVID, fortunately, we're still able to conduct activities on the ground. We're able to conduct our rapid needs assessments, our responses, and even post-distribution monitoring. But we have had to reduce the number of in-person trainings and workshops, which has posed some challenges in our efforts to strengthen the capacity of local partners. And so we've moved a lot of these meetings and workshops to online platforms or reduce the frequency or the number of participants. And we've also had to adapt our standard operating procedures for how we organize food, cash, and NFI distributions to respect physical distancing. And we've also established new partnerships with district-level health officials to conduct screening and awareness raising around COVID during our field activities. But even despite COVID, we had already committed in this 4th phase of our project to strengthen local partner capacity to conduct field activities independently, with moving towards only remote technical support from CRS as part of our long-term exit strategy. And luckily, we're already collecting data using ICT 4D solutions, tablets, smartphones, CommCare, and cloud-based databases. But in terms of challenges to strengthening local partners' capacity, we find that one of the big challenges from our perspective is a lack of consistent funding streams to support retention of permanent local partner staff. We see a lot of turnover, and we also see that our local partners recruit temporary data collectors for each rapid assessment or response or PDM. And so we're having to train over and over again new staff. And so that's really a challenge for us in terms of ICT for the capacity strengthening. And also our local partners, particularly based in the northern regions in Gao and Menaka, have really unreliable internet connectivity and inconsistent cell coverage. And so this poses a challenge when we're trying to organize online meetings or workshops or trainings. And we've also found that some of our local partners have a lack of familiarity or access to online conferencing technologies. So for instance, for one of our online meetings with local partners, we had to accompany them from the very beginning and creating a Skype account and testing that Skype account to make sure they were able to use it. And then we've also come across limited proficiency in data management and data security at the local partner level, which is something that we'll need to really focus on in terms of capacity strengthening. But in terms of best practices or lessons learned in this process, we found that developing and sharing step-by-step guides and standard operating procedures with partners, like having that documentation, really helps with facilitating trainings and handing over roles and responsibilities. Again, holding frequent and regular online or small in-person trainings when possible, as well as feedback and reflection sessions with permanent local partner staff has been really key. We've also been able to provide remote supervision and quality control using technologies like WhatsApp. We have a WhatsApp group with our partners, and so we can share photos to document how activities are being implemented on the ground and give feedback based on practices that we're observing through that, or just to provide quick communication support via WhatsApp or email. We also feel that accompanying partners in securing stable funding streams would help in procuring necessary technologies, smartphones, tablets, access to software, and to help promote staff retention. And another point that I just wanted to highlight would be in this process, we're trying to work on strengthening partner capacity and implementing feedback, complaints, and response mechanisms to help promote that transparency and accountability as they take on more of a leadership role in implementing activities. So for example, with our project, we have hotlines that project participants can call to share any feedback about our responses to inform our approach. And so gradually handing that over to partners and strengthening their capacity in feedback, complaints, and response mechanisms, I think, is a key aspect. So that's all I have to share for the moment. Thanks very much.
That's not little. Thank you very much, Maya, for your contribution there. And one thing that I like to highlight, which seems to be a theme that all three colleagues that already presented their insights have touched upon more or less explicitly, is the idea of the need for sustainability. Right, both in terms of being able to conduct the work, but also there are far-reaching and nuanced aspects of it. Right, for instance, to have a stronger ICT function to retain staff that is qualified and so on and so forth requires a higher level of sustainability of any organization, including INGOs, right? But also that applies to local organizations as well. And sustainability may require also diversification of resources or funding streams, right? Beyond perhaps prime readiness, there could be multiple areas, multiple aspects of it. Now, let's move very quickly, since time is running out, to Jenny Burns. From the UK Christian Aid. Please go ahead.
Thanks very much, and thank you for the opportunity to speak today. So my role is slightly different. My title is Senior Programme Officer Digital, and what that really means is that I'm focusing on our digital work in our programmes, which is, I think, sort of an ever-increasing role, and these kind of conversations sound like it needs to be around a little bit more. So COVID didn't really change my focus of work so much as finally prioritize it within Christian Aid, which was quite a nice change. And so we were already doing things which were required pre-COVID and suddenly just became more important, or at least finally we got recognition that those things were important. So there were two pieces that I wanted to sort of touch upon today. And the first one was around responsible data. So the amount of data that Christian Aid, and I mean, sorry, there's a lot of noise in the background. If you can't hear me, let me know. But the amount of data that we've been bringing in has obviously always been problematic. And that didn't matter whether it was digital or on paper. We've got a lot of information about personal information, sensitive information that needs sort of looking at. but it's only as we're suddenly working much more remotely and that digital tools and data are increasing that this has sort of come to the forefront, and people want to talk about how to be responsible with data and how to try and take the risk off the partners, because of course we can, have a lot of edicts at the top of Christian Aid, but we go through our country offices and then to our partners where the risk really is. So this issue that was quite small has suddenly been sort of increased, which was really, really exciting. And rather than it being a few of us talking about responsible data practices, we managed to I conducted responsible data training for over 200 members of our Christian Aid staff. We also have a working group that's been set up with people across all sort of different areas. We have people from research, people from security, people from MEL, and they're coming together and bringing different issues to discuss across our responsible data. And we've also managed to mainstream this, and I think that's probably one of the biggest changes, is that the conversation became big enough that other teams got interested within responsible data practices, and it's now a part of our MEL plan, which every project has to fill in. So it takes us through, there are 3 tables as part of the MEL plan, and one of them is how you're going to work on your responsible data practices. And this is worked through with our partners. It's not just our country offices or head office, it's something that's done collectively. And so that risk isn't just pushed onto other people, because I think that's one of the things which INGOs can be quite good at doing. So the idea is to try and reduce that. So we're just sort of beginning this journey. There aren't really resources for responsible data. There's just a few of us who are really passionate about it. But I think COVID certainly meant that other people joined us there. And then the other thing that I think the focus really shifted on for the last nearly 2 years now, we've been trying to implement a digital complaints and feedback system. And so I've been project managing that for a while. And it was only last spring that suddenly, again, resources, time and management were much more interested in the process, and it began to be pushed to the forefront. And that was because there was a shift from management that thought we could combine COVID data collection with our feedback and complaints system. Now, that has gone well temporarily. We are getting a lot of COVID data through our system, but what it means from the long term, at least from my perspective, is that we will have a digital complaints and feedback system. We will eventually remove the COVID questions and data collection, and we'll be getting information from our partners and from our beneficiaries coming in directly, and we're able to work through them as cases, and we're also able to sort of track root causes and ways in which we can adapt, and whether sort of issues are coming at, because often it's, something in head office has gone wrong and that really feeds down, but we don't see those results. And so not only was it COVID that it took for people to be interested in that and to push it from a management perspective, but also a lot of the funding has come through our DEC funding in terms of the COVID response as well. So something as practical as that was required to sort of prioritize it. And there's lots more I could talk about. We've talked about, Maya mentioned using digital sort of tools for monitoring and evaluation. We've also been doing a lot of that. We're struggling to keep track of that. There's just such enormous amounts of it. And one of the things that has been happening this year, and again, I think it's a prioritization due to COVID, is bringing that data off cloud and onto our own servers. So it's quite a big project for our ICT team, but I think it's going to have a really good end result. And there are lots of different elements that it needs enormous amounts of work. All of these pieces still being rolled out. Our complaints and feedback system especially is much more complex project than I think anybody thought at the beginning. So I could talk about it for a long time, but I'll just sort of leave you with something that sort of supports what Souraya was saying. And I repeat a lot because of my role being sort of really focused on digital. People tend to think of it in a silo and come to me about siloed questions. And I just think that we should be reiterating that digital should never be in isolation. We shouldn't be digitizing for the sake of it. We shouldn't be being innovative for the sake of it or using tech. It's all about sort of is that the best way to support the piece of work? What are the priorities for the organisation, and can we use digital techniques in learning to improve that? And that's sort of always what I'm trying to get across. So I'll leave it there. Thank you very much.
Thank you, Jen. This is interesting. One of the things that sounded very strongly in what you said, to me at least, is this, almost like the organizational development implications of digitization, the cultural, organizational culture implications of that, and capacity sharing or capacity strengthening implications of that as well. So, and it's a means to an end that has a transformative power when applied, digitization, that is. So I thank you for that. Thank you for that insight. Let's now move to IREX with Jesus. Please go ahead. You are muted, Jesus.
Sorry, apologies for that. I said thanks very much, Alberto, and the rest of the panelists. I'll move quickly because I realize we're short on time. Basically, so when I joined IREX about 3 months ago. Before that, I was with Mercy Corp early in the year, actually the beginning of the pandemic. Two very different organizations in terms of one perhaps much more development focused, and the other one having a mixed portfolio of development and humanitarian. But what's been super interesting for me is to see the implications, obviously, of COVID and with regards to the use of digital solutions on both organizations, and in particular with regards to supporting partners. And I'd like to highlight one thing is that when I look at the word partners, I actually start with our own teams, program teams, and field program offices, countries. I think ultimately, in many occasions, they are the ones that work with other local partner organizations as part of their programs. But it is extremely important, I think, to consider our own country programs and staff basically as our partners and those that we have to and we must support, providing them with all the guidelines and best practices possible to go through this pandemic and beyond. So at IREX, I'm part of a team called the Center for Applied Learning and Impact. This is a sort of a research and development team within IREX, with several experts working on different sort of technical areas. In my case, I work in data and digital development, but I support others that work in other areas such as youth and others. One of the very first things that IREX did at the beginning of the pandemic was basically realize that from the beginning, I mean, because of the fact that we were moving into a virtual space, it was critical to start developing some sort of guide that would basically help teams and partners, organizations operate in that virtual space. To start, basically, they started thinking, what are the guides that we already have in place that people are familiarized with, that we could leverage in order to then start incorporating sort of digital tools and a digital ecosystem into those guides. So the first thing that they did was they created what they call the Virtual Learning Thrust. Virtual Learning Thrust is a strategic priority for IREX in this year. There were other thrusts, such as the data thrust, that were also incorporated, but the virtual thrust was critical in the elaboration, design, and development of a guide called the Online Collaboration Guide for Facilitators. Now, this guide, which, as I said, it helps both people focus on training and learning, but also people that basically focus on online collaboration. So that could be a manager, that could be someone organizing a workshop, that could be anyone that basically has to have meetings and has to have online virtual collaborations with program members, with partners, etc. The interesting thing about this guide, though, is that we decided, or IREX decided, to build it based on an existing guide called the IREX Employee Essential Skills Suite. Now, this is a guide that basically is focusing on strengthening a number of soft skills, what we call youth essential skills. So things like higher order thinking, collaboration, adaptability, resilience, communication, empathy, inclusiveness. To me, this is key because the guide didn't start by listing a number of tools basically that everyone was using or everyone could use. The guide started to think, okay, what are the skills, what are the soft skills that we need to build on, that we need to integrate into this sort of digital environment, and started from there. So basically, instead of starting with the tools, starting with those skills, and basically starting assessments of those skills, etc. Some of the advantages of this approach, to me, that are now being reflected in how we're working with programs and partners, are basically a practical and learner-driven approach. Is very modular and customizable, focuses on power learners, which is a concept that we are developing at IREX. Also elevates the issues of gender and social inclusion in a virtual space, but also opens the possibility for blended basically training models in which we are combining the online and the sort of analog or in-person space. To move on, what this guide, or how did we decide this guide, or how successful this guide was in its design? It was very collaborative, and I think this is critical for any for success, basically supporting our partners. This was not a guide that was developed in isolation by the Center of Applied Learning and Impact, but rather a guide developed with feedback from numerous program teams and partners that in the end resulted on something that basically everyone could apply in their own environments. It started with a focus on what I call scanning, or providing a digital needs diagnostic assessment and decision making. That would basically look at things like what is the degree of digital literacy of those that are going to be